more educated on it as well. So there's not so much fear about, quote, going under the knife.
Right.
Why are we waiting,
yes.
right, until we're 70 to be able to get that? I'm not the surgeon here. Okay. So anyway.
You're making the sales very easily.
You're so welcome.
Yeah, thank you. What are your thoughts on these younger patients that are getting these procedures?
And thinking of the aftermath of that, right?
Exactly.
If you're getting that at 24, how often are you going to have to upkeep that?
Hi, everyone. Welcome back. My name is Dr. Brandyn Dunn. I'm a facial plastic surgeon here in Newport Beach, and we have an incredible guest today, Lauren Timpe. She is a injector at beautiful Omnia PL. Welcome.
Thank you so much for having me. Yes, as Dr. Dunn said, I'm calling you Dr. Dunn today.
No. Wow. I feel very special.
We're going formal.
Yeah, very, very special.
Yes, I am a co-founder and lead injector over at Omnia PL, located in Costa Mesa and the Inland Empire. And I've had the privilege of working with Dr. Dunn for the last 2 years. So it's finally all coming together today.
Yeah, very excited. So super excited to have you. And we have some really interesting topics to discuss. So the one that I would like to start with is, and this is very fitting because I think this is where there's a lot of overlap and lots of questions, and it's a pretty hot topic now. So we're looking at kind of the gray area between non-surgical and surgical facial rejuvenation, and kind of where, talk about how maybe you approach facial rejuvenation from a non-surgical standpoint, and maybe some of the concerns that you have, and we can kind of get into the nitty-gritty details of how patients can kind of balance and kind of blend both of these treatments to work well for each other. Because, there's pluses and minuses with everything, but let's hear it.
Yeah. Well, as a registered nurse, right, I have limited, I guess you could say, availability to what I can do. So I leave the tough stuff to you. However, I think I've learned quite a bit over the last 9 years of injecting. And I do like to take a full facial approach to my patients. I believe in global assessments as well as global results, because I have never been a big fan, and I think the industry itself has come so far in making sure that we're balancing the face, looking at proportions rather than isolating one particular feature. I personally believe in dermal filler injections, biostimulants, neurotoxin, and of course, maintaining skin health and improving skin health. So I tend to educate my patients on what type of maturation is happening in each layer, and then treating each layer that's going to provide them optimal results.
Right. And I guess a lot of patients, I think we've talked about this before, express some concerns about getting injections in the setting of possibly an upcoming facial procedure, facelifts, neck lifts. And you've expressed some concern in wondering kind of what happens. But I guess, what are the specific questions that people are asking you? Or are they hesitant? Are they saying, maybe I don't want to do injections? Or what conversations are you having around that?
Well, actually, we drive a lot of that conversation in our consultation, probably because of the relationship I have with you and the respect I have for what you do. But I think also that facial plastics and surgery has become much more of a available option for patients. Definitely. I think they've become much more educated on it as well. So there's not so much fear about, quote, going under the knife.
Right.
And so in our consultation, especially with my patients that are, I would say 45 and older, I am asking them, is surgery something that you're going to be considering? And if so, what's that timeline for you? Are you thinking that's going to be, within the next 3 years, or is it going to be, 5 years away? And my personal belief actually is that, and I educate my patients on getting surgery sooner than later. I think that they have better results. I think that they heal faster, and then they get to enjoy it.
100%.
Why are we waiting, right, until we're 70 to be able to get that? I'm not the surgeon here. Okay. So anyway.
You're making the sales very easily.
You're so welcome.
Yeah, thank you.
But in getting that information from them, then I feel like I can guide them on what is going to be the healthiest for their skin.
Right.
A lot of them are concerned about, well, if I get dermal filler, can I not get surgery?
Right.
I heard on TikTok that if I get Sculptra, the physician is going to have a harder time dissecting, my skin. And because of, again, my education with you and being open about those conversations, because I want the best for my patients as well, is that we know that that's not true.
Right.
And that I think there are certain time limitations that we're aware of.
Right. Yeah, I agree completely. And I just recently did a facelift on a patient. It was a mother of a very well-known injector, and she had quite a bit of filler and other types of Sculptra, other products injected before. And honestly, it was one of the cleanest dissections I've had, and it's incredible. And so I think that, there is something to be said that, yes, if there is injections, if there's trauma, if there are products that are injected in particular layers that are maybe not the optimal layers that they should be in, yes, it can make surgery a little bit more complicated. So I typically will tell patients, if you're thinking about having surgery, in the next 1 to 2 years, you can probably still get it. But if you're thinking about having in the next 6 months or so, up to maybe a year, maybe you should hold off, and then you can volumize yourself afterwards. And so I think, again, it's really about a collaboration where you can, the injectables are, once you have surgery, it doesn't mean that you can't have injectables or you shouldn't have injectables. You need to kind of maintain these facial volumes and help with your skin and all of these things. So definitely think you need to just make sure that your surgeon is aware of your history. I think that's the most important thing.
Yeah.
Yeah.
Can I ask you a question?
Of course, please.
To that point, getting the filler afterwards. Okay. I think for me, on conversely, right, to what you provide, it's that patients believe, well, if I get, if I save every dime for my facelift, I'm never gonna have to do anything ever again. Right. And you want to be kind in your approach about educating them. It's like, it actually doesn't work that way. This will always be, and I believe that it should be, a collaborative, invasive and non-invasive
100%
relationship. And I think that's why I'm so excited to be here today and talk about these things with you.
Yeah. I think I describe it to my patients all the time. If you buy a really nice car, you can't drive it off the lot and expect to not change its oil, get maintenance, fill up gas. All of these things are things to keep the car driving at its optimal and keeping it as nice as possible. And it's the exact same thing with the facelift. If you get a facelift, neck lift, whatever, any sort of rejuvenating procedures, you're going to continue to age as your car is going to continue to age, and you need to maintain it. And the way that we do that is by injecting Sculptra, maintaining tox every 3 to 4 months or so. All of those things are critical. You can't expect to maintain these really incredible results forever. That is one of the most important. And I have that discussion with every consultation, because if they're not willing to do that, really expectations need to be set. It's really important. So
it's great to hear that on the other side too.
Yeah.
Yeah.
I have a question for you. So,
sure.
Yes. So one of the things that's happening in this day and age, and I would be interested to hear your thought, is there are a lot younger patients that are getting facial rejuvenation procedures. I just recently saw a TikTok of someone that was 24 that got a facelift in Turkey. What are your thoughts on these younger patients that are getting these procedures? I'll tell you mine briefly afterwards. Go ahead.
Okay. I think that genetics play a big role in this. I think that there are, both men and women that are born with certain features that are difficult for them in their competence.
Of course.
Whether that's bone structure or it's, the placement of their facial shaping. Right. I should just leave it at that.
Yeah.
And so I think at 24, you're very young. And I would say you probably still have some maturing that's happening and changes that are going on. But at the same time, if you are not feeling good in your own skin, then, and you have the resources and availability to do something like that, I don't think it's incorrect.
Yeah. I see that, and I agree. And I think, it all comes down to anatomy for sure. So if they have the findings that warrant a procedure or would benefit from a procedure like a facelift or a neck lift or those types of things, then they meet the indication. But I agree with you. I think that there's a lot of changes that are going to occur as far as fat distribution, aging changes. There's so many different things that happen. And I think really at those younger ages, I think that if you have a significant amount of weight loss where you have huge amounts of skin laxity and those types of transformations, then I think a facelift or a neck lift is more reasonable for me. I think 24 for me is a little bit young.
It's really young.
Yeah,
It's
I think,
really young.
I don't know if I would necessarily want to be doing that, but yeah, I think it's good. These procedures are so advanced and are a lot safer. But I recommend patients that are in their early 30s and 20s for sure, to lean more into the non-surgical realm for sure. So
agreed.
well,
Thinking of the aftermath of that, right? If
Exactly.
if you're getting that at 24,
Yeah.
how often are you going to have to upkeep that for the remainder? What is your take on that actually?
Yeah. So the longevity of a facelift again goes back to your maintenance more than anything. So your sun exposure, your non-surgical treatments, all of those different types of things, and how you're eating and drinking and lifestyle, all of that, your weight fluctuations, all of that stuff affects your longevity of your results. But I think for me, we generally say anywhere from 7 to 15 years. You basically get yourself back to the aging changes that you had previously if you're maintaining it optimally. So does that mean every 7 to 15 years you're going to need to get a facelift? Yeah, that seems like a lot. Yeah. Don't start too early. Yeah. Well, anyway, thank you so much for this discussion. It was very, very enlightening. I appreciate your insight and I appreciate your trust in me with taking care of many of your patients. And I equally love being able to collaborate with you on all of these non-surgical patients. So thank you so much for taking such good care of them.
Thank you, Dr. Dunn.
Of course. Yeah. All right, everyone. Well, I hope you enjoyed that. We have many more episodes to come. Take care.